Good morning to all of you. So today we are going to learn the second part of management of stomas. Okay. Yesterday, in the previous class, we had studied the meaning of what is stoma. We had also classified it according to the anatomical position where the stoma is. Then we studied in detail how to do a colostomy irrigation. Okay, so that part is already over. So now today what we are going to end this topic is by studying some basic aspects of gastrostomy. So that was yesterday was classification plus detail of colostomy. So today it will be gastrostomy, because these are the basic stomas that we have in our body. Okay. So nursing care of gastrostomy feeding tube. Okay. So can you see this diagram? So this is a gastrostomy tube. You have a feeding bag. Formula is there. You can even have breast milk here. This is a grown-up child, so naturally breast milk is not required. So formula feed is there, and we have the pump, and from the pump the feed is going through this area. Okay. So these are the different techniques what we will be learning about. What are the different other ways of feeding through it. Okay. So here is the gastrostomy tube. So from the word itself it is clear this is connected to the stomach. We have already studied yesterday why do we need it, because if you have some any problem with esophagus, maybe a caustic injury where the child has already taken organophosphorus poisoning, or there is a severe stricture because of which there is reflux disease because the gastric contents are moving on to the duodenum, if that is the issue, or if you have esophageal atresia. So in this condition, we need to go for gastrostomy feeding. Okay. So at the time of surgery, what we usually do is the gastrostomy tube, usually the size is 20 to 26 catheter, is inserted into the stoma through the incision. Okay. So we have two things here. One is a gastrostomy tube, and it is inserted inside through the catheter. Okay. So catheter size is 20 to 26 catheter, and incision is made and it is inserted to the stomach. The distal end का क्या मतलब है? The end which is outside. Okay, ठीक है. So distal end is clamped to prevent leakage, and the tube is secured at the incision with one or two sutures. If you have seen gastrostomy opening, you will find that gastrostomy tube is stitched to the abdominal muscles so that it doesn't come out. Okay. So as the healing of wound takes place, a stoma or artificial feeding is formed, and a catheter can be removed and reinserted. Okay. So it is through the stoma we introduce the catheter, and this catheter can be removed and we can reinsert through this stoma. Stoma means artificial opening which is made in the abdominal muscles, and from the upper skin of the abdomen it goes inside the stomach. So what we need to have special attention? Special attention must always be paid to the skin around the tube, since there may be some leakage of gastric secretion, and unless the skin is kept clean and dry, it will soon become very irritated. So I will take back to the anatomy. We know that hydrochloric acid is present in the stomach, and normally what happens is hydrochloric acid doesn't harm us as long as the mucous membrane of the stomach is intact. But now here what we have is we have a tube which is introduced inside the stomach, and if there is some leakage around the skin, so gastric contents along with whatever juices are there, hydrochloric acid is there. Now hydrochloric acid is a very strong acid, and this will badly irritate the skin which is surrounding the stoma. Okay. So special attention has to be made to skin area to prevent the leakage of gastric secretion, and the skin has to be kept clean and dry. If you don't do this, then very soon the skin will become irritated because of the presence of hydrochloric acid. Now this is how, same thing. Okay. a feeding syringe, a clamp is there. Okay, if you want to give water, this is an extension tube, this is a feeding port through which the feeding is done. Now, dressing and skincare material should not be assembled the same tray with the feeding set. So this part we have to keep in mind, that dressing, skincare in the same tray, if you give feeding, that is not at all proper. So when the time intervals for doing all required procedure coincide, plan to do the dressing and skincare procedures first, so that the patient is as clean, comfortable and relaxed as possible for his meal. So if the timing of dressing and timing of feeding is coinciding means same time mein aapko dena, then what you need to do is you first do the dressing, make the patient clean, make the patient comfortable, so that he can have his meal times. Okay. Now the teeth and the mouth of the gastrostomy patient must be kept in optimum condition by frequent oral hygiene measures. See here, the feeding is not taken by mouth, but that does not mean that the oral hygiene has to be neglected. Frequent oral care has to be given. See normally what we do is, when we eat, salivation is there, numerous activities are taken during mastication, and there is a renewal of saliva. But here in gastrostomy feeding, these stimulations are not there. So it is very important that the teeth and the mouth of the patient has to be clean as far as possible by frequent oral hygiene measures. Okay. And what you do is, you can give chewing gum, and by chewing gum, all of you must have eaten in life. We do not take it inside, we just keep on chewing it. So by chewing it, what we are doing is we stimulate the flow of saliva and we keep the mouth moist. If the patient is unable to swallow saliva, then what you can do is you can give a sputum cup. All of you must have seen in TB or the chest ward, we have sputum cups available. So the patient can spit on it, and whatever is the amount of expectorated sputum, so that can be recorded in the intake and output chart. Okay. Now, long-term feeding access is best achieved by gastrostomy feed or gastrogenostomy. Okay. So gastrogenostomy tube. We have two types of tube. One is gastrostomy. Second is gastrogenostomy. Okay. So gastrostomy tube is an opening made from outside of the abdomen skin to the inside of the stomach. So it is very clear. Stoma is there in the outside of the skin. From the stoma, a catheter is inserted, and with the catheter, gastrostomy feed is there, tube is there, that is inserted, and it goes directly to the stomach. Okay. So this is used for enteral feeding. Enteral feeding means we want to give feed to the gastrointestinal system. So this is used for enteral feeding, or maybe due to decompressing. Decompressing means if you want to remove some secretions, okay, then you can even take it out. This is one thing. Next is gastrogenostomy. So this is called as GJ. This is G tube and this is GJ tube. Okay. So this is used for venting or decompressing the stomach while feeding is delivered to the jejunum. Okay. So where is jejunum present? It is the end part of the small intestine at this and at the starting point of so jejunum. In gastrogenostomy, what we do is our tube will end at the point of jejunum. Okay. So what we are intending is the stomach is not disturbed. Okay. So it is used for venting or decompressing the stomach. This is used so that the stomach gets decompressed. Okay. Decompressed means the contents will not be there, and feeding is delivered into the jejunum. Okay. Here feeding will be delivered into the stomach in gastrostomy, but in gastrogenostomy, feeding will be delivered into the jejunum. Okay. So this type of tube is used to prevent aspiration of gastric contents, gastric outlet dysfunction, or previous gastric surgery. Okay. So why do we use this gastrogenostomy? Gastrogenostomy is done. Gastrogenostomy is done to prevent tracheal aspiration of gastric contents. When we what we are interested is tracheal aspiration of gastric contents, means the gastric content should not go into the trachea. Okay, so that is why we use this gastrogenostomy tube. Second is gastric outlet dysfunction. If the connection between the stomach and the duodenum, if if you remember pylorus, okay, the end part of stomach is called as pylorus. So if you have any problems at the pylorus, that means gastric outlet dysfunction is there, or if there is a previous gastric surgery, so there is no space available, okay, sometimes maybe because of trauma or maybe because of tumor. So this or maybe due to previous gastric surgery, okay. So that is why this gastrogenostomy tube is there. So I think you have understood why this gastrogenostomy is there, okay. So in gastrostomy tube, the tube is fitted inside the stomach, but in gastrogenostomy the feeding is given into the jejunum, okay, and jejunum is the second part of the small intestine, okay. Where is jejunum present? It is the second part of the small intestine, okay. So in the second part of the small intestine the feeding is given, okay. So indications are we want to prevent tracheal aspiration of the gastric content. Second is if there is any problem in the gastric outlet, if it is not functioning properly, or if it is previous gastric surgery which decreases the amount of space which is available in stomach, then we have no other options rather than we will go for gastrogenostomy. I think you have understood the difference. When we do, why do we do gastrostomy and why are we interested to do gastrogenostomy, okay. So we had different types of tube here. First is a standard G tube. G tube is, we are talking about gastrostomy tube. Consists of high profile. We have two types of tubes here. One is high profile and one is low profile. High profile is with a long tube and low profile is something like a button, okay. Can you see this? This is a button one. Okay, so this button is low profile, and if you have a long tube, I will show slides on that, okay. So that is called as high profile, okay. So high profile or a long tube. So what does it have? It has external retention ring. Second is external balloon port, a feeding port, a medication port, and a safety plug and internal balloon. So these are the different parts of the gastrogenostomy. Gastrostomy tube. Okay. So what we have is we have an external retention ring. External retention ring means I will show you the diagram later on. So there is a ring which doesn't allow the gastrostomy tube to come outside. So that is external retention ring. And next is external balloon port. I will explain you. All of you must have introduced Foley's catheter. Okay. So what we have is we have two ports. One is the port where we attach the urinary bag, and second port is to inflate the balloon. Okay. So that is different ports. We have two ports, but here what we have is we have external balloon port similar to that we have in Foley's catheter, because we don't want the gastrostomy tube to come outside. So similar to a Foley's catheter, here we have a balloon port. Next is we have a feeding port through which we give feeding. Then we have a medication port through which we give medication, and an external safety plug and an internal balloon. So these are the different parts of a gastrostomy tube. Now the sizes range from 12 to 24 French. So depending on the size of the baby and age of the child, we select which type of tube we require, and it is graduated measurements. Okay. So graduated measurements matlab kuch lines rahega. Okay. Similar to that, then we know how much is inside and how much is outside. So graduated measurements are there, okay, which are helpful in determining the stoma length. And then this gastrostomy tube is placed primarily through any mature stroma tract, and it is to be changed every 3 months or as per the manufacturer's instructions. So these are the low profile balloon button and low profile non-balloon button. We have two types of gastrostomy tube. One is low profile is, see, both are, this is when you don't have a long tube. So here it is called as low profile. Okay. So low profile with button and low profile without button. So that is called as non-button. And this is how it looks from outside. Okay. Now gastrogenostomy tube. So gastrogenostomy tubes are classified as standard or long profile. Okay. So the standard GJ tube, that is gastrojejunectomy, is high profile. What is standard one? It is high profile external tube with, what does it have? It has a gastric port which ends up in the stomach, a jejunostomy port which ends up in the jejunum, and a balloon port. So these are the three parts in a standard gastrojejunectomy tube. One ending at stomach, one ending at jejunostomy, jejunum, and third is the balloon port. And there is an external disc which sits on the skin level and to hold the tube in place. Okay. Now we have a low profile gastric tubes, okay, button tubes, and it buttons have, as I have shown you the photograph earlier. So this is classified as balloon and non-balloon. And low profile balloon buttons have an external feeding port, a balloon port, and an external safety cap. And size is 10 to 24 French, and the stoma lengths are 0.8 to 6.5 centimeter. So we have of different sizes, and keeping in mind the age of the child, we decide which type of size we require. Okay, and depending on the size, the length of the stoma also differs. Then the diameter is 14 to 24 French. And gastrojejunectomy tubes are removed and replaced every 6 months. Gastrostomy every 3 months, and here gastrojejunectomy every 6 months. See, this is how, this is a high profile gastrojejunal feeding tube. Okay, so this is the external ring, and this is the long tube it is attached, and this has 3 different ports. Okay, one is for stomach, one is for jejunum, and one is for balloon. Okay, so these are, see here it is written 22 French. So we have the size written here, and keeping in mind the age of the child, we require which type of it is. Okay. Now, when we give medications, there are certain points to be kept in mind. First is only liquid medications can be given. We cannot give solid liquid. Okay, so we either push it directly with the syringe, or as per the instruction given by the manufacturer. Okay, then flush with at least 5 ml of water after the medication is administered to prevent clogging the button with medication remains. Okay, suppose if you don't flush it, what happens is the medicines will remain in the button itself. It will not go inside. So after medication, you have to give 5 ml of water. If the medication is a capsule, then what we do is we dissolve 5 ml of warm water. 5 ml, we take 5 ml of warm water and put this contents of the capsule in it, and then we mix it and give it to the child. Okay, suppose if it is a solid medicines, then what we do is we have a mortar and pestle, we crush it and mix the medication in water, crush the pill with the pill crusher, then again we add 5 ml of warm water and mix it until it is dissolved properly, and then it is given. So what things to keep in mind, whether it is a capsule or a liquid, or whether it is a tablet, everything has to be converted into a liquid form, and then only we have to give it. And one thing to remember is after medication, we have to flush it with 5 ml of water, so that medicine will not remain in the button itself. Okay. Now, each medication should be given separately. No two medicines should be combined together, and do not crush or mix the medications together. Different medicines has to be crushed separately and given separately. Okay. Then it is not best not to mix the medication with formula or put the medication as a feeding bag. Should not mix all the things together. And if the medication needs to be given in an empty stomach, so what we need to do is we have to give the medication 1 or 2 hours before the feeding if possible. Okay, then again flush with water. So I have already told you. Okay, now oral care is very important. Here what we need to remember is the child is not eating or drinking by mouth. Okay, so but oral care is important because these children, because they might be immunocompromised, so they can have gum disease, they can have cavities, they can have gingivitis and other infections of the oral cavity if the oral hygiene is neglected. Okay, so that is why very important the oral hygiene has to be maintained by frequent mouth washes, and oral care again will depend on the age of the child. Okay, suppose if the child is too small, then before the teeth erupts, a baby's gums needs to be massaged. Okay, so that is there, and if the teeth is there, then it has to be brushed at frequent intervals. Then activities such as occupational therapy, physical therapy, rolling, crawling, walking should resume as soon as the child is comfortable. Okay. So whatever age-related activity of the child is there or different therapies is there, they have to be started as soon as the child is comfortable. Okay. Now, Miss, some few lines regarding feeding delivery methods. Okay, we have to feed. What are the different methods? We have three methods basically. One is by gravity, second is syringe, and third is pump. Pump, I've already showed you the picture earlier. Okay, gravity is gravity feedings are delivered from a feeding bag through an extension set into an open syringe. Okay, you must have all given rise to feeding. So what we do is we introduce the syringe, remove the piston, and then we pour out and we just hold it. So through gravity it goes inside. So that is gravity feeding. Syringe feeding is what we load it in the syringe, then push it directly into the open syringe into small amounts and should not be more than 0.5 to 1 ounce. 1 ounce is 30 ml, should not push more than 50 to 30 ml at one time. Okay, place no longer than 18 inches above the tube size. Okay, so once we hold this syringe, should not be above more than 18 inches. Okay, then pump feedings are administered from the feeding bag through the extension set. Okay, so we have pump which is electrically operated. We have syringe, we take the amount and push it directly to the opening, and third is through gravity. We pour the contents in the syringe and we hold up, and the height should not be more than 18 inches, and the contents will go through the gravity. Okay, so these are the three different methods. Next is a rapid infusion with a pump or bolus feeding with an open syringe are not recommended in the J port. Suppose if it is a gastrogenostomy feeding, then we have to remember that rapid infusion cannot be given. Okay, suppose if we give this, then it results in dumping syndrome. Dumping syndrome, if you remember, this is one of the complications of peptic ulcer, especially after the partial gastrectomy is there. So because the size of the stomach is small, so whenever the child feeds, the feeds directly go into the small intestine. So here, when it is a gastrogenostomy tube and if you feed very rapidly through the GJ tube, then what happens is it leads to dumping syndrome. Okay, and apart from that, diarrhea is characterized by unpleasant reaction caused by sudden arrival of a high volume of refined carbohydrates into the small bowels. So this results in dumping syndrome. So what we need to do is continuous feedings of at least 6 to 8 hour intervals at a slower rate. Provides constant mucosal stimulation to aid intestinal adaptation, which enables absorption and decreases vomiting. So the best method here is we can have the pump where you can adjust the rate, and then it has to be given 6 to 8 hour intervals. So by doing this, there is a constant mucous stimulation, and this helps in intestinal adaptation, facilitates absorption and decreases the vomiting. Okay, so this is how we can give. And now infants can be fed out either breast milk or formula feed, and breast milk, we know it is much better as compared to formula. So this is gastrostomy feeding through gastrostomy tube. Okay, this is through a syringe where the baby is being fed. Now, as conclusion, gastric tubes and gastrogenostomy tubes are commonly used in children who are not able to consume adequate calories by mouth to gain weight and grow. Okay, so they are commonly used when the baby cannot take due to different reasons. Okay, so many children need this type of tube long term, and families of medically complex children are increasingly expected to manage this technology at home. See, this is very important. As a nurse, as an ostomy nurse, it is the nurse's responsibility to teach the parents how to take care of the tube, what things to be kept in mind, how to adjust the rate, how to keep the skin clean, and how to maintain, when to come for checkup. All these things has to be told to the parents, because this this is not an overnight procedure that you do a procedure today and then tomorrow it will remove. It is not that. It takes some time. Okay, so that is why this families of these type of children, they need to be counseled, and then return demonstration of the parents regarding taking care of this gastrostomy gastrostomy tube or gastrogenostomy tube has to be taught to the parents. Okay, so these devices have become a significant part of lifestyle for many children and families, and because once it is introduced, this may stay in the baby's or the child's body for a long period of time, depending on what are the indications. Okay, so it is a significant part of the lifestyle. Okay, nurses are involved in patient and family education early and collaborate with healthcare team to provide optimal care. So as nurses, we have to ensure our level best so that the optimum care can be given to the family. So as a nurse, we should understand and become familiar with the types of tube, what are the basic methods of care, and what are the complications associated with enteral feeding, so that we can be very helpful for the patients. Okay, so that was all about the gastrostomy feeding. We also studied about the different types of tube, what are the different types of openings which are present. We have all studied. I hope you have understood the topic. Thank you for a patient listening.